I'm Dr. Ashish Singhal. I'm an orthopedics and joint replacement surgeon and a practicing arthroscopy surgeon here at Paras JK Hospital, Udaipur. So today we'll be talking on importance of musculoskeletal health and the other things which are affecting the persons. So musculoskeletal health, it plays a key role to keep up good mobility and dexterity in an individual. So that means जो अपनी body है वो muscle और skeletal से बनी है and it plays a key role और जो भी हमारा health है उसको maintain करने में हमारा balance maintain करने में along with enhancing their ability to work and actively participate in all aspects of life. Good musculoskeletal health is also crucial to maintain economic, social, and functional independence across their life course. So, one if is if social musculoskeletal health is good, so person can be physically active, mentally active, and socially also active. So musculoskeletal health is very important. Physical activity has a crucial role in reducing the risk of other non-communicable diseases and it can only be achieved with adequate musculoskeletal health which means अगर आपकी musculoskeletal health अच्छी है तो अगर आप थोड़ी physical activities कर रहे हैं जैसे cardiac issues होते हैं obesity होती है knee problems होती है back problems होती है that won't be there. So now coming on to the thing is what is the relationship between painful musculoskeletal conditions and reduced capacity to engage in physical activity. So impaired musculoskeletal health, if any person has, can lead to acute and chronic pain. So we get regular patients with acute and chronic pain, which causes physical limitation. People are not then they are bedridden, they're not going to job, proceeding in loss of participation and withdrawal from usual social, community, and occupational activities. So the loss of working hours is a huge loss to the person and the family and the company itself, further decreasing the quality of life and well-being, including mental well-being. So if all these things happen, indirectly his mental well-being gets also disturbed. Impaired musculoskeletal health can lead to substantial personal, community, and societal consequences, particularly in older people. An individual with arthritis and musculoskeletal disorders is sure to be lesser active than an individual with a better musculoskeletal health. So you understand. So today, maybe in a OPD, around 70% patients are of arthritis. So the main complaint is they're not able to do their regular functional activities. Bathroom jana hai, bazaar jana hai. They are dependent on other people. Their confidence gets down. They get obese, गिर जाते हैं कई बार, and that can lead to spine fractures, hip fractures, and wrist fractures as well. So और वो एक बार अगर गिर गए या पेन होते हैं तो their confidence goes down as well, which can lead to depression and other things also. Thus, a lack of regular physical activity emerges as the most prevalent risk factor associated with functional decline. आपने बहुत regularly देखा होगा people who get retired and घर पे बैठ जाते हैं, sooner or later their health declines, their physical activity declines. So most importantly, impaired musculoskeletal health causing reduced physical activity like grip strength, walking speed, chair rising, and standing balance has been frequently linked to increasing mortality. Thus, weak musculoskeletal health is a key component of frailty. So, what is the impact of impaired musculoskeletal health? The impact of impaired musculoskeletal health is now recognized globally with an increase in morbidity and mortality related to it. Good musculoskeletal health is crucial for maintaining an active, productive, and prolonged working life. With the increase in the global retirement age, we need to be physically active. We need to have good musculoskeletal health, and uh, and that is why it is increasingly important for older workers as many as occupation and work-related activities are associated with musculoskeletal disorders like low back pain and shoulder disorders. So people who have low back pain and shoulder disorders, they are not that active, and the employers may find them not so useful for work. That can lead to their early retirement. Thus, it is important to identify and implement effective interventions for people with musculoskeletal conditions to remain productive at work. High income countries observe musculoskeletal conditions to be one of the major causes of work loss, early retirement, and lost retirement wealth. While developing countries, musculoskeletal condition to have a major impact on livelihoods, because like a country like ours, even I see people who are having severe pain, severe incapabilities, impairments. They have to work to earn their livelihood, because in developed countries they have their pensions, they have the other health benefits which are not so common in developing countries like us. So they have to work together with the impairment musculoskeletal conditions, and that can further lead to deterioration of the health. Thus, reduced musculoskeletal health results in reduced productivity and economic loss to society at many levels. So, what is the burden of disease related to musculoskeletal conditions? Is the next topic which I think of is uh, non-communicable diseases now account for most of the global burden of disease, with musculoskeletal conditions being the leading contributor in those. So most common is back pain, knee pain, cervical pain, you know, along with these smartphones, these thumb pains, metacarpal pains. Developed countries will recognize the transition of burden to long-term disabling conditions. However, now low and middle and low income countries are also demonstrating the enormous future impact from musculoskeletal conditions such as low back pain, osteoporosis, which I've already mentioned, driven by the increase in population growth as well as aging. Since age is the commonest risk factor for musculoskeletal condition, it's estimated that by around 2050, there will be a 5 times rise in the people over 40 years living in developing country, contrasting the wealthier country. Additionally, obesity is one of the major risk factors. I would always say uh, musculoskeletal condition is directly related to obesity and your less physical activity, your sedentary lifestyle is also hypothesized to rise dramatically in the developing world over the coming 2 decades. Furthermore, increased use of motor vehicles is not only reducing physical activity but also increasing the number of motor vehicle accidents and resulting musculoskeletal trauma and disorder, which can also lead to disability or impairment, also leading to loss of working hours. So, believe me, I tell my patients to uh, use cycle again. I use my bike cycle for going to nearby places, which helps me to remain fit, as well as my musculoskeletal health is better, saves money also. So now, what is the role of physical inactivity and sedentary behavior in musculoskeletal health? So believe me, most of the current situation, obesity, and low musculoskeletal health is due to these conditions only, which lead to other non-communicable diseases like low back pain, heart attacks, other cardiac issues as well. So, sustained and systemic urbanization in developed countries has led to sedentary behavior among the people, particularly younger ones. So, our kids now they are really obese. They are not. They don't want to, go out and walk or cycle. They have cars along with drivers. So they're not playing outside. COVID are also resulted in lesser going outside of the our children, which has led to obesity. Also, the use of smartphones. People are not playing outside. This is also one of the main reasons. The rapid growth of legions of video games, social media, movie streaming, and binge watching seems to be the prime contributor. This surge in sedentary behavior is not only a major risk factor for many chronic diseases, but is also recognized as a substantial global economic burden. So, evidence shows that effects of sedentary lifestyle can be reduced by a small amount of activity every day. One of the recent meta-analysis it shows by utilizing the data of more than 10 lakh people concluded 1 hour of moderate level activity daily can eliminate the increased risk of death associated with 8 hours of sitting, which is very harmful. Thus, a moderate level of physical activity remains a key requirement for healthy aging and maintaining musculoskeletal health. So, sedentary behavior is a major contributor to obesity as well as type 2 diabetes, which is very common. It's like a growing like an epidemic in our country. Likewise, obesity is also a major contributor to development and progression of osteoarthritis. So I tell my patients that knee or any hip osteoarthritis, well, three major causes are age, which you cannot change, genetics, which you cannot change, weight is the only thing which you can control or change. So you need to control your weight to avoid the progression of osteoarthritis. And with severe epidermal evidence suggests that increasing the levels of physical activity will not only increase musculoskeletal health, but also decrease the risk of suffering from obesity related disorders such as diabetes. What's the WHO recommendation on physical activity for healthy individuals? Nearly 2 hours per week of moderate physical activity, which is so less than 20 minutes per day or about 20 minutes per day of any kind of physical activity like brisk walking is recommended by WHO. I would suggest cycling for all people who can do. These exercises elevate heart rate and are known to be associated with a lower lifetime risk of cardiovascular diseases, which are on the high rise. Apart from rendering musculoskeletal health benefits, improvements in cardiorespiratory fitness can be achieved by changing sedentary behavior to achieve a low intensity physical activity like walking. Exercise is now widely prescribed for the rehabilitation of musculoskeletal conditions and it's used as a preventive health measure now widely investigated with guidelines around the type, frequency, and duration of activity being considered. So most of the initial patient which I get for chronic back pain or knee pain, we more than the medicines we advise physiotherapy or exercises. Around 70% of them are obese, leading very sedentary lifestyle, which is not acceptable considering the age group they stay on. Um, uh, Previously, I used to see patients of knee pain or back pain in age group of more than 50 years. Now, this has decreased to almost 20-25 years. People less than 15 years are also coming with back pain, knee issues, not because of the injury, because of the age, weight, and sedentary lifestyle, and due to the lack of other supplements which are necessary also. So, low back pain and neck pain can be benefited by staying active and exercising regularly, which is very clear with the way we are talking. Group exercise program or weight loss support can be considered. This can be helpful for the people who think exercising alone can be boring or not that exciting. To reduce the incidence of false balance and strength training, home hazard assessment, participation in fall prevention programs, and getting involved in activities like gardening, dancing, etc. helps. Osteoarthritis can be shown to be benefited from activities and exercises that improves muscle and aerobic fitness, like walking, swimming, Pilates, weight loss support, can be rendered if required. Uh, I'll also explain the association between healthy aging and physical exercise. Aging is inescapable. Everybody has to age, everybody has to die. But it can be made easy and healthy with the help of exercise. Milka Singh used to run so much. Milind Soman at 55 is doing amazing. Exercise renders many benefits to the aging body, including reducing the manifestations of aging, especially the aging phenotype of the elderly. A recent systemic review concluded physical exercise renders a positive impact on muscle mass and function in healthy subjects, aged 60 and above, by improving muscle performance by increasing the ratio of type 1 to type 2 muscle fibers and increasing the cross sectional area of type 2 muscle fibers. So, furthermore, exercise and mechanical loading also have a positive impact at the molecular, cellular, and tissue level. Like with aging, the potential for cell proliferation and this number of stem progenitor cells like decrease in tendon. Exercise loading can induce these cells and they can increase the collagen synthesis. Physical exercise and mechanical loading also have a positive response in maintaining cartilage and bone health. This is called dynamic loading, which I'm talking about. जित आपने देखा होगा जब पेशेंट रेस्ट पे होता है, बिल्कुल बेड रिडन हो जाता है, उसके हाथ पांव बिल्कुल पतले हो जाते हैं, गुड मतलब जॉइंट स्टिफ हो जाते हैं, एंड पेशेंट हु आर मूविंग उनकी मसल्स एक्टिव रहती हैं, जॉइंट स्टिफ नहीं होते हैं. So we need to be socially, physically active. Physical exercise and mechanical loading also have a positive role in maintaining cartilage and bone health. As I have already told, moderate exercise could also enhance the quality of tissue produced during the healing of injured tendon, which we advise. What is the relationship between obesity and musculoskeletal disease? I think, as I've already told, exercise is the most common thing. एजिंग से आप escape नहीं कर सकते हो, उसके लिए भी exercise जरूरी है. Obesity और musculoskeletal disease is directly proportional, और उससे बचने के लिए हमको exercise करना जरूरी है. So in and out exercise करना बहुत जरूरी है. A surge in sedentary behavior and unhealthy diet have caused a global obesity epidemic, along with a sharp rise in the incidence of type 2 diabetes. These are further great risk factors for cardiovascular and neurodegenerative disease, which further complicates the management of musculoskeletal diseases. So, thus, strategies aimed at reducing obesity in adults will reduce the occurrence of osteoarthritis, and thus can alleviate some of the pain of the condition. Interesting, obesity is the only one of the modifiable risk factors of OA. As I've already mentioned, you cannot change genes, you cannot change your age, but you can only change the obesity thing. Exercise and weight loss have benefited overweight and obese adults with NEO in many clinical trials. So, thus, combining modest weight loss with moderate exercise can provide the best overall improvement in symptoms of pain and joint function. So, as I already mentioned, nowadays I'm getting patients with 20 25 years with severe knee pain, back pain. So, the main reason is the childhood obesity. सो ये तो बचपन में माँ बाप बोलते हैं भाई खिलाओ बच्चा मोटा करो. नहीं, दिस इज रॉन्ग. सो पेशेंट हु आर बच्चे हु आर ओबीज, हु आर नॉट एक्टिव, आसपास के पीयर और जो चिल्ड्रन है वो उन्हें और चिढ़ाते हैं. दे गेट एक बार वो फेज शुरू होता है, then children they start getting obese, they don't exercise, they don't play, they're scared कि सामने वाला चिढ़ाएगा. So there is a vicious cycle with the obesity starts, and so such as the physical activity. Lack of physical exercise in childhood causes childhood obesity, which further leads to musculoskeletal pain in later life. Thus, reducing obesity in children by encouraging physical activity, parents has to step in, will also reduce the risk of developing musculoskeletal pain later in their life. So, first 30 years, your bone starts to develop, your muscle starts to develop, and then there is a plateau phase, and then bone starts to get weak. This is a normal cycle in every person's life. So, if you are physically active, you are exercising, you're taking good diet, then your bones are strong, muscles are strong, and they will support you while you are when you are old. Furthermore, consumption of unhealthy diet and sedentary lifestyle is contributory to the increased incidence of childhood obesity. Low in nutrition value and high in caloric content food further contribute to the obesity epidemic, which may also play a role in the high prevalence of type 2 diabetes and cardiovascular diseases. So, I think obesity का main reason obviously sedentary lifestyle and diet है, which I'm already talking about. So, diet is also a part of healthy living. So it is one of the major causes of musculoskeletal health. How does it affect? I'll tell you. So diet is definitely an inevitable part. 3-year follow-up study, including about 400 adults, shows that diet high in potassium reduce the amount of muscle loss in adults more than 65 years, which we get in fruits and vegetables. Dietary flavonoid intake from fruits and vegetables is also known to be positively correlated with good bone health. That is, it increases the bone mineral density and reduces bone resorption in perimenopausal women. So we definitely give flavonoid supplements also in postmenopausal females. Improving the diet of OA patients have also shown great benefits. Vitamin D, calcium, and magnesium supplements, and definitely increase protein consumption have been shown to optimize muscle, bone, and functional outcomes in older people, reducing their fall and fractures. So fractures in old age and osteoporotic patients are usually very bad, complicated, and it is very difficult to fix them once they are happen. Calcium and protein synergistically optimize bone health. Thus, dietary strategies for improving musculoskeletal health should include consumption of long chain fatty acids, vitamin D, potassium, and decreasing blood cholesterol. Antioxidant rich diet may benefit athletes by improving tissue repair. Sarcopenia in elderly people can be benefited by combining exercise with increased protein intake. Whey protein can be added with vitamin D to increase muscle mass and strength. So I think, in nutshell, a good musculoskeletal health can, I'll just summarize once again, is very important to support the uh, your physical, mental, and social well-being, which will let you to work for a longer time, to be socially connected with your family. The main bad factors are in sedentary lifestyle, unhealthy diet, not taking proper care of the supplements or calcium you're taking. What to do is what uh, they can cause is non-communicable disease like cardiovascular disease, depression, low back pain, knee pains, falls which can lead to fractures. So उसके लिए क्या करना है हमको? Definitely at least 20 minutes daily exercising, brisk walk, cycling, swimming, whichever you are comfortable with. Uh, Good healthy diet, which is a balanced diet. भूखे रहने से कभी वजन लॉस नहीं होता. It needs to be proper. Balance in high in proteins, long chain fatty acids, low in cholesterol and carbohydrates. And I think that is it. If you are physically active and your musculoskeletal health is good, you'll be happy in your old age. Thank you.